Welcome back. You're watching Checkpoint. Now, Machakos County is one of the 4 counties that piloted the universal health coverage in 2018 as a county prone to frequent road accidents. What has been the impact of this rollout, and how are cancer patients benefiting from a new cancer treatment center which has been up and running for 5 months now? Our reporter Grace Courier toured the medical facilities in the county and filed the following report.
64-year-old Joseph Mutuma had been to various hospitals seeking treatment for cancer, but it drained him, especially financially, until he decided to go back home to Machakos Level 5 Hospital.
Kurudi hapa nilikuwa karibu nikufe, na kurudi hapa haki niliona hapa matibabu hapa haina ya kawaida. Sababu hii dawa niwekwa sabari, hii ni sabari ya 3 na nimesaidika kabisa. Naona nilikuwa na vitonde mingi, naona hizi zimeanza kuona, na unaona hapa karibula mpaka hapa hivi. Kwa hivyo kutoka hiyo wakati nilianza kuwekwa hii nini, unaona vile naendelea.
He says his condition has greatly improved. His script is not any different from that of 67-year-old Mary Mutuku, who just like Mzee Mutuma had been to a lot of medical facilities.
Matumaini yangu ninaona nitapona kwa sababu vile ninaendelea, na sasa niko kwa matibabu kamili leo. Ninaona nitaendelea, lakini huduma yenyewe ilinifanya hata nianze kupona mentally.
For 67-year-old Pauline Munyao and her husband Peter Ngundo, all they are grateful for is the heavy financial burden that was lifted from their shoulders, especially after being diagnosed with cervical cancer, going into remission, and later on being diagnosed with cancer of the bladder.
Hapa ni free. Tunatibiwa free na tunaendelea.
Hapa hakuna malipo yoyote, kila kitu iko sawa sawa. Ukija hapa unakupewa tu receipt, alafu unaendelea, hakuna kukaa. It is very fast. Unaangaliwa alafu unatoka mara moja.
Sijawahi kulipa kitu kwa sababu nimekuwa registered na MTiba. Hata kwa NHIF mimi ni customer wao.
Now you may ask how that is possible. Machakos County is one of the 4 counties that piloted the universal health coverage. So with a UHC card, or what residents here refer to as MTiba card, one can access these services.
Those who are registered under universal health care, then they receive free treatment. And for the ones who come from the neighboring county, like Kitui and Makueni, also they get treatment at a subsidized fee. Those who are from other counties like Kajiado and Nairobi, also they are charged at a fair price.
And that is not just at the Level 5 hospital, but in all hospitals across Machakos County.
On a monthly basis, we see around 800 to 1,000 patients, both male and female, and there are those that are new attendants and those that are on follow-up. They keep on coming for regular follow-up.
Patients here seek different services, among them screening for cancer, treatment which includes chemotherapy, consultation, nutrition and palliative care. It's about 5 months since the cancer center was set up.
With the installation of the lab within the center, we can actually process this tissue and actually confirm someone has which type of cancer and further imaging what stage.
At one of the maternity wards with a 35-bed capacity and 14 nurses, Olive Ndhamba holds one of her twin daughters while keeping a keen eye on her other daughter on the hospital bed. She is elated to have her bundles of joy with her. Along a different row, we find Joyce Mwende, an equally excited mother of a baby girl who traveled all the way from Nairobi County to Machakos Level 5 Hospital.
We have showers. The doctors are very good to us. The toilets are clean, Everything it is clean. The food is so sweet.
On matters affordability, the script of these mothers is no different from the cancer patients we spoke to.
I only spent the fare to come here. On arrival, I was welcomed with the MTIBA, with the universal health care. Everything was catered for.
The nursing officer in charge of this ward elaborates on the number of deliveries they get.
Roughly in a month, we have around 700 deliveries, ranging to between 25 and 30 patients in 24 hours deliveries.
Machakos County nurses have not held any industrial action in years.
A motivated employee is an employee who delivers. From the county government, our salaries are paid on time.
All the healthcare workers, the unions, we've been engaging them on no aspects the matters that might arise. We've signed a number of CBS with a number of those unions.
Dr. Kituku further highlights an award ceremony held by the facility in December 2019 in a bid to motivate them. So how are the numbers of the patients visiting the facility?
We managed to register around 86% of the population, around 1.2 million people. But since the pilot started, we've noted from our records by December we had seen 2.8 million visits.
Now, in a bid to enhance healthcare in the county, the leadership of Machakos County purchased 70 ambulances and a further 5 advanced ambulances with about 84 paramedics and 75 drivers.
We can save patients who are in need maybe of oxygen simply because we have our oxygen machine in the ambulance. We can secure people who have cardiac conditions because we have our distributor in the ambulance. We can also secure those patients maybe who are diabetic because before we take them to the hospital, we have our glucometer machine there.
We have ambulance stations in the major highways, like in Mombasa Highway because of road traffic accident, Kangundo Highway, Kitui Highway, and Makueni Highway, and even Garissa Matu Highway, whereby these shifts work in 24 hours.
And that is not the end. The facility is looking to purchase more ambulances to enable access to the entire county and subsequently employ more professionals. Grace Kuria, KT.